Welcome to another episode of the About Mansfield Consumer Advice Series. I am your host, Steve Casillo, and right here to my right, that would be your left, that is Dr. Joseph Adams with Calibration, Chiropractic, and Functional Health right here in Mansfield, Texas. Welcome back to About Mansfield.
I'm excited to be here.
We have done now a series on migraines. We've done a series on concussions. We've done a series on dizziness, and now we are moving on to disc herniation. And this is actually something that within the past year, I've been told that we're going to get kind of technical here. My L5, I have a slight bulge in my disc, which may be or may not be pinching a nerve. Mm-hmm. And so maybe starting off with disc herniation 101, what is a bulging disc? What am I going through?
Yeah. So this is like one of the more common things that people go through in their life, and that's really because back pain is like one of the number one disabilities worldwide. And our backs take a lot of brunt, throughout our lives, right? And there even are some researchers that, study, the spine that think that we only have so many bends in us, right? Like we can only bend so many times before we actually damage a disc. And so a disc is like a gel-filled fluid sac in between your vertebra, and it provides for shock absorption and movement. Yeah. And so that's its purpose, but you can herniate that disc, and that herniation can cause pain.
Okay, describe a herniation then when it comes to a disc.
Yeah. So what happens is when you herniate a disc, you're going to have weakening of the outer fibers, like the sac that holds the fluid in there. And that herniation can extend out of the joint space, and it may end up pressing on a nerve that is right there next to it. And that pressure on the nerve can cause what's called radiculopathy, which is just a term for your nerve is going to be on fire screaming down your leg or your arm. And not everybody has that happen when they herniate a disc. It can be more subtle than that, and you may not have that, radiculopathy nerve burn, but you may just have good old back pain, right? Or neck pain, because you can have this happen in your neck, in your low back, more common in the low back than probably the neck, and then you can have it in your upper back or mid back in the thoracic spine. Those are a little bit more rare, much harder to treat. And so that's basically what it is that you bulge a disc, or you rupture a disc and the fluid squeezes out, and then that's a little bit worse.
Let me see if this analogy works with describing a bulging disc for the viewers and for the listeners. That if I had a balloon in my hand, and the balloon is filled with air, fits within the palm of my hand. Yep. But if I squeeze it and part of the balloon pops out, would that's bulging?
Yep, that's exactly what a bulge is. Yep.
Ta-da! That's all right. How does one get a bulging disc? Like I said, my L5, and I don't know if you've suffered from a bulging disc or not, but how does one get a bulging disc?
Yeah. So there's a couple different ways you can get it, and I'll share a little bit of my experience because I actually have had this happen to me, and it sucks. But usually it's just over time, right? And that's the most common is that just over your lifespan, the disc outer fibers will break down and you'll get a bulge, or you'll get a herniation, or you'll get like a major herniation where it squeezes all the fluid out and goes up a level or two. And so usually it's just over time, it just breaks down. Mm-hmm. But then you can also have injury. And so this is probably the second most common one. And that's what happened to me. So there was like a really bad ice storm in Dallas, maybe a decade ago. It was actually right when I was starting chiropractic college. And I came out of my apartment, third story, slipped on the ice and fell down 20 stairs, concrete stairs, just boom, 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 boom. Got up and I was like, "Oh, my back hurts a little bit," but it wasn't too bad at the time. And then the next week, there was a dog that was running out of my in-laws' house, and he was headed for the road, and really quickly bit down and twisted and grabbed the dog to catch him from running out on the road, and got some severe back pain then. And so that's how I herniated my discs. And so, it can be, pretty painful. For me, though, I had the back pain, but I didn't really have a lot of the nerve pain going down the legs.
Yeah.
So it wasn't really obvious that was going on. But I've been through this, and, we've been able to treat it, without, surgery or medications in my case. But that's another one is, injury. But another one to consider too that's very common is just people who work repetitive jobs. So like factory workers, anybody doing a repetitive task over
Heavy lifting.
again. Heavy lifting would be one. Like I've seen people who, like warehouse workers lifting or just like doing the same tedious stuff over and over again can break down specific regions of the body. And then another one that is kind of a newer one that people don't really think about is, just lifestyle stuff. Like, so people who have, diabetes, like type 2 diabetes are more likely to have issues with their discs. People who are overweight are going to have more issues. People who have high levels of inflammation as well are going to have more issues with it.
All right. I've got it. How do I treat it?
Yep. So there are a lot of ways to treat this. So we can talk about the more common ones. And the more common ones are really just more common because they're medical based and are, accepted and integrated into the current medical system. And so a lot of times it's going to be medications. So, getting muscle relaxers are prescribed a lot. Steroids can be prescribed for this, painkillers as well. Just a note on this, a lot of people in the past, decade or so have, unfortunately died in America because of the overprescription of opioid painkillers.
Sure, right.
And so please, do not start opioids for this condition. There are much safer approaches out there. And if your doctor does offer you these, you probably need a new doctor because it's against the guidelines at this point. So medications is one, but I tell you what, a lot of people don't really respond well to medications. And I just see that because they come to me and they're like, I'm still hurting. I'm on the muscle relaxers, the steroids, and the painkillers, and I still hurt. I still can't function. And then if, the medications don't work and you're still in, pain, they may send you to physical therapy. Mm-hmm. And physical therapy can provide good relief. It is a long process, though, to get through that to where you feel good again. The other things that may be prescribed are injections, so steroid injections that are actually going in deep into the back, big, long needles, where they'll get really close and inject steroids close to that disc herniation. And then they can also go in there and burn your nerves, so they'll take needles deep into your spine, get them in right next to all the nerves in the low back, and then fry them all. To give you relief. Now that's temporary because they're going to grow back, over, maybe 6 months to a year, just depending on the procedure that was done. And then if none of that works, then surgery is the last option.
Surgery, going under the knife, pair of Fiskars, and so the bulge. The end result is you want to get rid of the bulge.
Yeah. So they'll go in there and they'll snip the bulge and or remove some bone. Or both, and then sometimes there's a fusion. It just kind of depends on that individual case, but surgery definitely should be the last option. And the problem with surgery is that sometimes they don't get the pain generator right, so like what's actually causing your pain. And so you can have surgery and maybe you don't get better because they didn't get the pain generator right. Maybe it wasn't the disc.
Let's talk about calibration chiropractic. How do you treat a bulging disc?
So we like to do it in a very safe way that it causes no long-term damage, like surgery and some of the other options could possibly do. So, standard of care in our office and, based off the research is spinal decompression. So, if the whole goal is to take pressure off the nerve, get that bulge back in, we put people in a machine and pump that low back or neck and allow that pumping vacuum pressure effect to suck that disc back in, take pressure off the nerve.
Yeah.
So decompression, rehab, just like we talked about physical therapy, chiropractic adjustments, shockwave therapy is very good at treating this. It gets people out of pain really fast. And then we also will co-manage these cases with other providers like pain management and neurology, depending on what is best for each and every, individual patient with this condition.
Again, real brief, how does someone know that they have a herniated disc? And once they have made that determination, how can they reach out to Dr. Joseph Adams?
Yeah, so if you have an accident, a really bad accident, and you immediately have back pain, and the back pain is really, really bad, and you maybe have some nerve pain running down your leg, or if you notice that going into extension really lights up your back pain and that nerve pain, you probably got a disc. Or if you've got back pain that just won't go away no matter what you do, you probably got a disc. And so you can always find us at calibrationmansfield.com, or you can just do a Google search. We're pretty much everywhere.
Calibrationmansfield.com, that's the website. That is another 10-minute nugget of information, and that's the About Mansfield Consumer Advice Series. Dr. Joe, let's do it again real soon.
Let's do it.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.